everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Recently, if you follow me on Instagram, I did a short, what I call them now, Dr. Z snippets, where there's 60 seconds or short little video. I do the same thing on TikTok, by the way. So if you want to follow me on Instagram or TikTok, the link is in my banner. But I did little shorts where I talked about sexual functioning, changing and feminizing hormones, and how there's options for you out there in order to be able to deal with it. And one of the viewers asked me to do a longer video and to elaborate this on more. So I'm doing this video to talk about how sexual function tends to change, not for everybody, but for a lot of people, on feminizing hormones. And I'm here to tell you what your options are, how to deal with it, why it tends to change, and two groups of people that I see that tends to fall into this category. So feminizing hormones. For starters, when you are taking feminizing hormones, regardless of your gender presentation, your gender expression, even if you're taking feminizing hormones solo, without any anti-androgens, such as testosterone blockers or anything like that, estrogen in of itself can be powerful and often is powerful enough to bring down testosterone levels. When testosterone levels go down for individuals, it does actually affect sexual functions for trans femme-identified individuals. Usually that will manifest in having a harder time, your sexual libido will go down, so having a hard time maintaining that sexual arousal. It could also manifest as hard time being able to get erection and having a hard time being able to sustain and maintain erection during sexual intercourse, whichever sexual intercourse, by the way, you engage in. So that can become quite problematic. And I've seen this happen to primarily two groups of individuals. I'm sure there's a lot of other groups, but these are the two most common groups, and you may fall into one of these groups. Group number one are trans feminine identified individuals who have a lot or some level of dysphoria toward their genitals, but for personal reasons. And maybe the reasons are financial, maybe the reasons are medical, maybe the reasons are something completely else that's personal to you. For those personal reasons, you are unable to get gender-affirming bottom surgery that you really want. So here you are, you're living, and you maybe at any point in your gender transition, whether you are in the beginning or maybe you have completed your gender transition, whatever that is for you, and you're living with male genitalia, you're living with penis. And because you're living with male genitalia, you are sexually active. Whether you're in a relationship or not, doesn't matter. You don't have to be in a relationship to be sexually active, but you're sexually active and you want to have sex as part of your healthy lifestyle. And because you're sexually active, or because maybe you want to be sexually active, being on feminizing hormones is now affecting your sexual function. And that is frustrating, and that is strenuous, and that's very stressful for those of you who want to be able to maintain sexual function. Group number two that I tend to observe are people who don't have gender dysphoria towards their genitals, who don't really hate their genitals, who may be not crazy about their genitals, but they don't have any dysphoric feelings about it. Or there may be individuals who are not even gendering their genitals at all. Remember, not everybody is going to gender their genitals into groupings of male, female, or any other type of gender expression. So there's a group of people of you out there who feel neutral, feel maybe even comfortable with your genitals, even though you are going through transition, or even though you have transitioned again, whatever that is for you, and you are on feminizing hormones. And again, just like group number one, you want to be sexually active. You want sexuality to be part of your healthy lifestyle. And because you're on feminizing hormones, you can't, because you're struggling with being able to maintain or getting an erection or being able to sustain it, or your sexual desire tends to struggle. So what to do in those scenarios? By the way, I want to be very clear, this doesn't happen to everybody. I had individuals whose testosterone level has been dropped down to very, very low numbers, and at the same time, they were still able to maintain erections, they were still able to maintain same level of sexual arousal. Nothing has changed for them. And I have even individuals who went to such extent where they had orchiectomy done and they were still able to maintain and sustain some element of their sexual functioning. So it doesn't necessarily go across the board that it will affect everybody, but it does affect significant amount of individuals. And for those of you who want to retain sexual life and sexual functioning, this can be strenuous and this can be very frustrating because it is frustrating when we try to be sexual and things don't work how they intended to work, or things are presenting challenges that you have to confront and deal with. So what to do about it? What are your options? There are actually a number of options for you on the table, and I cannot stress enough how important it is to talk to your medical provider about the options you do have at your disposal. A lot of times, what I find with a lot of transgender individuals is this challenge, this struggle to bring it up with a medical provider. A lot of times people sometimes think that if I bring up that I want my genitals to be sexually functioning, what is the medical provider, or maybe you're bringing it up to a therapist, maybe you're bringing this up to your hormone provider, or to general family therapist, or even to your endocrinologist. Sometimes people think, well, if I'm going to bring up this element that my genitals are something that doesn't cause me discomfort, doesn't cause me dysphoria, or that I want to be able to enjoy a sexuality using my genitals, what if that provider will look at me and they will say, well, that just invalidates the fact that you're transgender because you're really out to hate your genitals. So this is number one misconception that I see. I think for provider to think that that's going to be a pretty outdated provider, a most likely provider that is using a very old cookie cutter approach. Most providers understand that a lot of people today feel very differently about their genitals. But I can understand how it can be very difficult, especially if you work in, let's say, if somebody you've been working long term, and bringing it up can make you feel as if it's going to invalidate your transgender identity. So just keep in mind that in no way how you feel about your genitals invalidates your transgender identity. Many trans women decide to keep their genitals. Many trans women have penises. Many trans women feel very comfortable with their penises. Many trans women enjoy using their penises sexually. And many trans women have their penises and have dysphoria and wish they could do something about it, but by personal reasons they cannot. I really apologize, guys, for this. I'm getting this incredible big sunlight, so if I come across all very pastel-y, sorry about that. So just wanted to mention that. So it doesn't invalidate your gender identity by any means at all. It just means that you're an individual that knows their body really, really well and knows how they feel toward particular parts of their body. So that's number one. Number two, don't be afraid to bring it up to medical providers because, like I said, they do have solutions. Some of my clients have used two of the primary solutions I've seen my clients to use without going off or switching or lowering their estradiol dose. The two primary solutions I've seen: one, sexual erectile medication, such as Viagra. I have seen people being prescribed that medication, and I have seen people being able to obtain help using that medication. Remember, one of the things people don't know about sexual functioning medication is that sexual function medication will help blood flow to that organ, and it will help penis to get erect. But sexual medication are not going to give you sexual desire. So sexual desire has to be something that you'll cultivate within yourself. A sexual medication is not going to necessarily give you that sexual desire. So that's one of the things that sometimes people not aware of. But medication such as Viagra is very helpful and absolutely can be prescribed. So don't be afraid to be prescribed that medication if sexual function is important to you, if that's something that you really want. If you feel like it's going to make a difference in your sexual life and sexual routine. The other second thing that I've seen that has been very helpful is being prescribed topical testosterone creams that people do put on their genitals, and that helps with erections, that helps with being able to maintain erection, and it's actually, people have reported, has helped with sexual desire. Testosterone topical cream can make some people uncomfortable somehow this idea that you're using testosterone, that you're trying to repress, but yet you're applying it, it just can create quite a bit of attention for some people. Some people feel very comfortable about it, and they understand that it's a very low dose. You're going to use it you're not going to use it daily. So they have an understanding that in such low dosages, on occasions when you are engaging sexually, it can be very helpful. And I think that's one of the good ways to look at it that way. But I do know that for some people, it can feel also very dysphoric to use topical testosterone cream. But also can feel very dysphoric to use medications such as Viagra, because traditionally, socially, we think about Viagra as something prescribed to men. So I'd be careful not to gender-stereotype, this type of helpful things that can really help you with your sexuality. But those are two major things that I've seen that has really helped my clients, and I'm sure that medical provider or your hormone provider will even have some other options that they'd be willing to share with you, to discuss with you, to help you try out. I think sexuality is incredibly important to human beings, whether you feel dysphoria toward your genitals but want to be sexually active, or whether you don't feel any dysphoria and comfortable with your genitals and want to be sexually active. Sexuality has number of major benefits, a lot of benefits, not to mention one of the biggest benefits is that it really distresses our nervous system. So I always encourage having a healthy sexuality, and part of it is being sexually active, whatever that is means for you. So if you feel like feminizing hormones has really affected you and you feel stuck and you don't know what to do, trust me, there are options. There are things that you can find, things you can talk to doctors, you can get prescriptions. So I would really encourage for you to consider that. And try again not to gender those options, because the minute you gender, that's the minute you give that part of your brain like an ammunition against yourself, and I don't want you to feel that ammunition. So comment below, let me know if you fall into this camp or you're struggling with this. Have you found a solution by now? What was the solution? Was there some other solution beyond what I'm mentioning here? Share with everybody else. I'd love to hear, love reading all of your comments, and I'll see you all next time. Bye.